Hi, I'm Dr. Gbur. What I'm going to do is explain basically what happens if you come to the hospital for a heart catheterization. I'll go through the basic steps and what to expect when you get here, and also what to do when you get home. If you're coming to the hospital for a heart catheterization, you've been told to not eat anything the night before. So when you get here, you'll report to registration. They'll sign you into the hospital and then bring you to the cath lab waiting area. Our recovery nurses will check you in and go through all the basic steps, which will include starting an IV, asking you a bunch of questions, and basically getting you ready for the heart catheterization. Once you're ready, the cath lab staff will take you to the procedure room, which I'm sitting in now. And although there's a lot of equipment, this is something we do every day. We'll give you a little bit of medications to help sedate you and have you relaxed. We really don't put you to sleep. It's not like general anesthesia. And then once you're in the lab, we'll either go into the artery, usually in the wrist, but sometimes we can also use the femoral arteries in the groin. We insert a small tube called a sheath into the vessel. And this has a little valve on it that prevents blood from flowing out. And we can put our catheters in through that so we don't have to keep basically sticking you in the vessel. We then put small catheters through that tube that go up into the heart, and they have different shapes and forms basically to fit into the heart arteries. And we'll inject dye through these catheters into the arteries, and our x-ray machines will move around you. We'll take several different pictures and different views so that we don't miss anything. Once we're completed, then typically we do a ventriculogram, which is with a different catheter. We inject dye into the ventricle, and you'll often feel a warm sensation. It'll last about 30 seconds and then it goes away. And then the whole procedure takes 10 or 15 minutes unless we have to do more or actually fix an artery. After that, the technicians will come and they'll take out the catheters, and you'll go back to the recovery area and you'll have to lie flat for a certain period of time. Most people get to go home several hours after the procedure. I really ask that you don't do any heavy lifting. If we go through the groin, you can get back to your normal activity usually after about 2 days. If we go through the wrist, you can't use that wrist for a couple of days, but you can do most other activities. Like any invasive procedure, there are associated risks, although they're very minimal. Normally, if we're recommending a heart catheterization, then in our opinion, the benefits far outweigh any risk. So typically, the most common complications are discomfort, bruising, and mild swelling where we put the catheters in. There can be more serious risks such as stroke, death, but quite honestly, these are very, very rare. And in an elective procedure, it's less than 1 in 10,000. If a heart catheterization has been recommended, it is because, in our opinion, you have a condition that carries with it a serious problem, which could lead to a heart attack or other medical problem. So again, in our opinion, the benefits of doing the procedure far outweigh any potential risk. In general, we'll follow up with you in the office 1 or 2 weeks after the procedure, but there are certain things you should be aware of where you should notify us. If you have continued bleeding, swelling, or pain at the site, or if there's purulent or pussy discharge or anything like that, fevers, chills, you should contact the office or our answering service so that we can evaluate you. So what I've been talking about is for a diagnostic catheterization. Once it's done, then we make a decision as to how to best treat you. And it may be as simple as no specific treatment is required, or we can treat your condition with medications. In the event we find a blockage that's relatively low risk, we would actually fix it at the same time as your diagnostic catheterization. That may make your procedure last a little bit longer, and typically plan on another half hour to an hour. But the recovery and follow-up care would be identical. If it's something that's more complex or may require a surgery, then at that point we would meet with the surgeons or with you and discuss in more detail the risk and benefits of our planned treatment. and that would probably be scheduled for a later date. Hopefully this video will help you understand what's going to happen when you have your heart catheterization. If there's something I didn't cover or you have any other questions, please don't hesitate to contact our office or ask the nurses when you get here.